Hello and welcome to a brand new episode of Health 360. Well, the week gone by has seen so much conversation around the obsession with anti-aging. Products that are to keep you looking younger, defying age, and even perhaps compromising with your health. Shefali Zariwala's death and the possible link with anti-aging medicines is being analyzed. This incident has thrown up a whole lot of questions on the industry of anti-aging and what it is doing to all of us. We're exploring that up ahead on the show. I'm Sneha Moldani. You're watching Health 360. Obsession with anti-aging is now fairly common amongst the general population. Regular people are getting Botox done like one gets waxing done. It's actually so common now. But a lot of this has got to do with celebrities normalizing cosmetic procedures. Also Botox, the use of glutathione, fillers and much more. This report delves into how celebrities have popularized anti-aging treatments.
I don't feel the need to justify why I want to look a certain way for myself. Then they said, did you get fillers? Yeah, I did.
In the spotlight of Hollywood and Bollywood, where youth is often equated with relevance, many celebrities have turned to Botox, fillers and anti-aging treatments in a relentless pursuit to preserve their looks. With intense industry pressure and constant public scrutiny, maintaining a flawless youthful appearance has become more than a personal choice. It's often a career necessity. While some stars embrace their enhancements openly, others quietly conform to unrealistic beauty standards, creating a cycle where natural aging feels taboo. From frozen expressions to unnaturally plumped features, the pressure to look forever young overshadows the acceptance of natural aging. The anti-aging fixation among celebrities reflect a deeper anxiety within the entertainment industry, where growing older is often seen as growing irrelevant. From Hollywood to Bollywood, stars are increasingly turning to Botox, fillers, skin tightening treatments and even biohacking in an effort to defy time. But does this obsession not only distort public perception of beauty, but also raise questions about authenticity, self-worth and the high cost of perfection in an image-driven world?
And joining me right now is Dr. Viral Desai, cosmetic and plastic surgeon from Mumbai's Desai Hospital. Thank you so much for your time, Dr. Desai. I want to begin by asking you about anti-aging products that celebrities have popularized in a way that even regular people are getting drawn towards it. Anti-aging products and treatments have become just so common among the masses as well, isn't it? What role do celebrities, Dr. Desai, have had to play with normalizing the use of these products?
So anti-aging is a very wide terminology. There are a lot of products which are taken orally, some are taken by IV drips, some are taken topically, and some are also taken by IV infusions and topical applications, right? So these common products are mostly vitamins like vitamin C, vitamin A, vitamin D, B12, complex, amino acids. Well, anti-aging industry has been a very large industry globally and also in India from a very, very long time. It's one of the most rapidly growing industries. As you meet people, as day by day, as people are more aware of internet and social media, they want to look good, feel good. So that's why people are gymming more, they're taking care of their body more, they're more healthier, they're eating well, they're eating healthy. And similarly, of course, people use a lot of perfumes, makeups, so many other kind of products. Similarly, they also are looking more to age gracefully or anti-aging or look better, look younger. I would say actually look better rather than looking younger. And of course, take care of certain issues which occur with aging, like wrinkles, like loss of collagen, poor skin texture, loss of moisture, pigmentation which happens with aging, and so many other factors. So yes, it's basically not about celebrities, but generalized awareness which has increased because of social media and internet revolution.
Right. Dr. Viral Desai, I appreciate your time here. Thank you so much for joining in. Well, there also is the world of B-town celebrities and a dozen-plus Hollywood celebrities who vowed never to go in for anti-aging treatments, who promised to age gracefully and embrace aging. Let's tell you more about those celebrities who are doing things a little differently.
In an industry obsessed with youth and perfection, a few stars are rewriting the script, choosing wrinkles over needles, grace over glam, and real over retouched. Here's a look at Indian celebrities who've said no to Botox, surgery, and anti-aging supplements, and yes to aging with authenticity. Recently, actress Malika Sherawat took to social media with a powerful message. In a candid Instagram video, she appeared without makeup or filters, speaking openly about embracing natural beauty.
There is no filter that I'm using. There is no makeup that I've put on. I haven't even brushed my hair yet. This is the first thing I'm doing. I'm sharing this video with you so we all together can say no to Botox, no to artificial cosmetic fillers, and yes to life, yes to a healthy way of living.
Meanwhile, Kareena Kapoor Khan has also chosen transparency over trend. Speaking at celebrity nutritionist Rujuta Divekar's book launch, Kareena said she's against Botox injections. Instead, she believes in self-preservation, natural therapies, and letting age take its course.
Self-belief is everything, however you think, however you feel. It's not about the way I look, it's about the way I feel. And that's what, for me, aging and life is. It's strength training, walking a little, my Surya Namaskars, doing my little work on my own rather than, I'm spending time doing all of this rather than, skin treatments and Botox.
But Kareena and Malika aren't alone. Tabu, still radiant in her 50s, is known for her grace and glow, without ever turning to fillers. Her mantra: yoga, clean living, and self-acceptance. Actor and activist Nandita Das has long rejected both fairness creams and anti-aging pressure. She champions natural beauty on and off the screen. Konkona Sen Sharma, known for her bold performances, wears her age with pride. Her belief: beauty is about truth, not transformation. Veteran actress Ratna Pathak Shah proudly flaunts her silver strands and speaks out against the pressure to look young. In a world of filters and fillers, these women are keeping it real, reminding us that age isn't a flaw, it's a story worth wearing on your skin. Their message: aging isn't something to fight, it's something to own.
A trend where people, particularly young adults and teens, seek cosmetic surgeries to resemble their filtered selfies from social media apps like Snapchat. Does it sound unbelievable? Well, it's true. This is driven by the constant exposure to unrealistic beauty standards, perpetuated by filters that alter facial features, leading to a desire to replicate these digitally enhanced appearances in real life. Yes, Mom. Imagine a situation where a person stops feeling happy about themselves and they're unhappy all the time because of the way they look, because they're so used to seeing themselves in filters, essentially. They've become habituated to see themselves in filters. Well, these filters create a version of you which is not real. Perfect skin, glass-like, big pouty lips, red lips, flushed cheeks, perfect features, light colored eyes. But is that your natural self? That is not your natural self. What happens as a result is that you start hating your natural self.
Some people even consider getting cosmetic surgery to look like their filtered selfies. That, ladies and gentlemen, is Snapchat dysmorphia. A growing issue, especially among young users, and it is truly worrisome, getting even more potent as virtual beauty becomes the new normal. Doctors say they're seeing a surge in young patients asking for procedures not to correct real flaws but to match their filtered photos. Experts warn this could lead to deeper mental health issues like low self-esteem, anxiety, and even depression. The pressure to look perfect online is making people question their natural selves offline. And in a world where face filters are just a swipe away, the real danger is forgetting that authenticity doesn't come with an edit button.
Well, as you scroll endlessly through these curated feeds and perfect filters that make you look like you don't look like, the question to ask right now, is this really a moment where we are losing touch with reality? And Dr. Dipali Bhardwaj, Senior Dermatologist, Elska Clinics and Max Hospital in Delhi's Saket, is now joining us. Thank you for connecting. I want to begin by asking you a little about Snapchat dysmorphia. It's so common nowadays, and it really can be very serious to many young people. In your opinion, how problematic do you find Snapchat dysmorphia? Dr. Bhardwaj.
Well, Sneha, it's the saddest thing is that's when I came to know there is something called Snapchat. This is the worst times that we are living in, where the youngsters are so damn influenced by these filters, by these pictures of Bollywood themselves with filters all over Snapchat, Instagram, and they see all these movies and, they are making reels. It's going crazy. How we read in your media all the time where people are dying taking selfies, and trust me, I get a lot of young patients who bring photographs of themselves in filters, and they're ready to do anything. They're ready to spend anything to look like that in real, which is impossible. Interestingly, maybe I was a little behind. I did not know that it is their filters. Like few years ago, 5 years ago, patients used to fool us. They used to show us the picture and they used to say, this is themselves only a few years ago. And doc, now my blush is gone, my cheek has come down. So as a dermatologist, I used to start taking academic interest and trying to release and give them that kind of a result. But then I realized that they were themselves in filters. So, this is how these youngsters have their mind very, tricky, and they are fooling the doctors also. So we doctors also need to be alert. There are a lot of filters and there are a lot of things with which now I think everybody knows that how AI is operating. But, 5 years ago it was new. And but I feel the mental psyche of such people really needs to be counseled. It's through your media they should realize that everybody is very pretty. Beauty is one color.
Dr. Samir Parikh, Chairperson of the Mental Health Program in Fortis Hospital, is now joining us. Thank you, Dr. Parikh. Talk to us about the role that social media, Snapchat filters play in making people so underconfident and unsure about themselves. How does this affect their mental health and cause body image issues?
I think one needs to understand this from the context of how does social pressures influence a young mind especially. When you constantly get feedback that this is the right look, this is the right way to look, this is how you should be. So that should be creates a conformity pressure. And it may affect you in terms of how you look at your own self, your body image, your self-esteem, your self-concepts. And sometimes when you start giving more value to these external vectors, you may start feeling inferior or less about you.
That's really dangerous. I mean, it may not look, dangerous or worrisome at the first glance, but it just perpetuates a mindset that you need to look a certain way, you need to conform to a certain standard, and that is absolutely terrible. Dr. Parikh, thanking you for your inputs, your time here. A strong and important distinction has to be made. Anti-aging medicines by itself are not inherently dangerous. What's risky is its misuse by unqualified practitioners. The problem lies with unlicensed or unregulated providers in anti-aging medicines. When grounded in science, ethics and clinical oversight can be a helpful tool for wellness and longevity. Here's how you can do this right.
From capsules to cosmetic procedures, the anti-aging industry is experiencing a rapid surge. But behind the promise of flawless skin lies serious health risks. As more people turn to supplements, injectables and off-label treatments in pursuit of youth, medical experts are sounding the alarm. What was once the beauty secrets of celebrities, anti-aging treatments like collagen boosters, glutathione shots, PRP therapy and hormone supplements is now easily accessible to the general public. These methods claim to slow signs of aging, but when misused, can pose serious dangers. The most pressing concern, self-medication. Health professionals strongly advise against using such products without proper medical guidance. So what precautions should you take before trying any anti-aging medicines? Always consult a certified dermatologist. Avoid online purchases without prescription. Get blood tests and allergy checks done. Do not mix supplements without doctor's advice. Pregnant or breastfeeding women should avoid medicines, as should those with chronic kidney or heart disease. Even natural-sounding remedies like glutathione or collagen peptides can clash with existing medications, especially for individuals with conditions like diabetes, thyroid disorders or heart problems. Many assume that natural means safe, but that's a myth. Even vitamins, when overused, can have toxic effects. Aging is a biological process, and while it's tempting to chase youth, one should focus on healthy aging over harmful shortcuts.
Senior hair transplant surgeon Dr. Arika Bansal from Eugenics Clinics is now joining us. Thank you so much, Dr. Bansal. You know, every now and then we hear and we see, news items, and it's absolutely depressing, of just so many people who have undergone hair transplants and it's gone wrong. People have died very recently in Kanpur. As a hair transplant surgeon, what would be your word of advice to people even running to salons really to get these, cosmetic procedures that need to be done, in an operation theatre and not in a salon?
Patient's general health should be screened before the surgery. This is a cosmetic surgery. We can't afford a single morbidity or mortality due to the procedure, because people are doing it for enhancing their look. It's an elective procedure. It's not something which is saving their life, or they are in a near dying situation. So we cannot afford to have any kind of miss in that situation.
Well, at least check for the certification is so important, You just can't do it in a regular salon. Talk to us, Dr. Bansal, about what you think of younger people, who've hardly had hair loss and they're wanting to go in for transplants. Is this not body dysmorphia as well?
Body dysmorphia is a little new, and it is increasing day by day, because everybody tends to have a personal Instagram, Facebook account, and everybody is showcasing their life, their complete life activities through that. So an obsession with appearance has increased in the younger generation, which has led to an increased incidence of body dysmorphic disorder. But not all cases of young people coming for a hair transplant have body dysmorphic disorder. Some people do genuinely have baldness, which requires surgery only.
All right, Dr. Bansal, I'm going to thank you for joining in, sharing a point of view with us that some people for medical reasons do go in for hair transplants. But other than that, obsession to look, in a certain way is certainly problematic. And Dr. Ishan Desai, facial plastic surgeon and founder of the Face Center, is now joining us. Thank you so much for your time. I want to begin by asking you, anti-aging medicines are not without side effects. at this point in time, I'd want you really to put the focus on what the potential dangers really are. Patients need to be told about the potential misuse of these medicines as well, isn't it?
You're so right, Sneha, because, this anti-aging and aesthetic medicine industry is, it's a booming industry. But there are a lot of supplements which are part of this industry which actually don't have any clinical trials, proper research behind them. And often there is no standardized dosage of how long these medicines should be taken, what are both the short-term and the long-term risks. And often many of these medicines are available at pharmacies, and sometimes without a prescription, people are self-medicating themselves and ending up with all kinds of side effects. So, we need to be very careful with what we are, as doctors, prescribing to our patients. At the same time, the patient should also be aware that, without a prescription and without proper knowledge, just to chase this kind of youthful face or youthful appearance, you can't compromise your health. I believe in something that supplements should be given when a person is deficient in a particular aspect. So, for example, if you're deficient in iron, you give iron supplements. If you're deficient in vitamin B12 or folic acid, you give supplements for the same. Simply giving supplements for long duration, supplements which don't have much research behind them, is a very harmful, practice. I feel it can lead to all kinds of problems. And also, if you give a particular supplement, even the good ones, like, for example, let's say you give an iron supplement or a vitamin D supplement, it should be taken for the time limit that has been prescribed by the doctor. If it's a 6-week course, then you take it for 6 weeks. You don't indefinitely take it, because there's always a risk of, too much. Too much of a supplement can lead to toxicity.
All right. It's very important. And also doctors, their role also becomes important in telling the patient what the possible side effects could be. Dr. Satyasai, I'm going to thank you for your time here. Appreciate your joining us with those very important inputs and that light that you throw on the fact that supplements can't be forever. You need to go back to your doctor and check if they should be continuing with those medications or not.
Absolutely. Thank you so much.
Thank you. It's time for a quick commercial break here on the show. Much more news around health, wellness and fitness in just a bit.